Good morning, namaste. It's been some time since I have been wanting really to speak to the young girls who might be beginning sexual activity and what it actually entails in a human, both medically, socially, and psychologically. I thought that it would be a worthwhile eye opener for some of the girls who are get into sexual activity because it seems to be the fashion or it seems to be the norm of daily life. So, first of all, I would like to emphasize on the medical implications of sexual activity. We all know, of course, that one could get pregnant, but the most important thing is that if you have sex with one person, you have had sex with all his partners before or her partners before, because the bacterial flora that is in the genital tract lives for a long time, and they pass on from one partner to the other. So you could be exposed to several sexually transmitted diseases, of which we are all very well aware of AIDS, but there are others which could lead to infertility and the tubes being blocked, like chlamydia, which could, such as, and also others which are recurrent. They reappear like herpes virus 2, and the worst of all is the human papilloma virus, which can cause cancer of the mouth of the womb, which is known as the cervix. So it's not about frightening into not having sex, but it's about the fact that you should be aware that there is a vaccine available for the human papilloma virus, and therefore you need not subject yourself to the possibility of cancer later in life. Before sexual activity starts, this vaccine is best taken. It has several strains, which can cause cancer. Some will cause warts, and so on. The body naturally also eradicates it, but even so, why take the chance? So the vaccine is available, and it is given in 3 doses. First injection, then after 2 months, and then after 4 months. So I would urge all young girls to be vaccinated against human papilloma virus, even if they have not indulged in sexual activity, because in the future it would be preventive of any problems, cancer of the cervix especially. Now, that is just the medical aspect of sexual activity, and the best form of contraception, of course, is both too. One is the pill. The young girl should use the pill because that is going to be in her hand. Please do not use emergency contraceptive pills as a method of contraception. It is an emergency pill, it's an emergency pill, not for regular use. Otherwise, you'll destroy your cycle as well as you may not be protected. So it's very important that you understand that the emergency contraceptive pill is not the answer. You should be on a regular pill for 21 days, starting on day 5, and then continuing it till such time as you would like to have a child. And that power will be in the girl's hand. However, the male partner should always use a condom, because then the transmission of these sexually transmitted diseases can be reduced to minimum. So, with these precautions, I would say that the medical aspect is roughly covered with regard to what complications or problems you may have. But there are psychological implications, because in the human, unlike the animal, other animals, there is an emotional bonding before actually sexual intercourse takes place. And that is why when that bonding separates, a person or the partners actually suffer an emotional trauma and a scar in their minds. Besides that, if they have multiple partners, they will start comparing the partners, and it leads to unrest, distress, and totally so called life which then they cannot cope with emotionally. It leads to depression, it leads to obesity sometimes, and there are very many psychological implications of having had sexual intercourse with a person. So before you engage yourself into any such activity, consider. We are not talking here about morality. Consider the ramifications, the medical complications, the emotional trauma that you might suffer if you separate from this partner. And if there is the chance of it being or separating, better to avoid it. Is it not possible that we can prevent better than trying to cure it later and visiting psychiatrists? And perhaps you do not know one very important uh, thing, aspect of sexual intercourse between man and woman, and that is the spiritual. That is the spiritual, and that is that. Sorry for the interruption. That is that we become involved karmically as well. So you share the karmas, and God knows what karmas the other person has come with. Do we really want to buy them? And you may or may not believe in it, but the fact remains that the possibility is there that you're going to suffer the medical problems, you're going to suffer the emotional problems. What more karma can you talk about? So there might be other karmas as well. So therefore, I urge you to just be aware, conscious, not because I think it's a sin or that you're going to suffer some things about it. You are going to suffer, that is for sure, because there will be these problems that I have highlighted. But it's not about that, it's about the fact that you want to live a happy, healthy, confident, and fulfilling life. So, with that, I hope that I have inspired you to know that what is in your interest, what is good, how you should be aware of it. Thank you. Namaste.